So we've been preparing for this moment and these requirements ever since we started Encore. And knowing that this was going to come, knowing this day would come, we didn't know what would be in them, obviously, but we did know that there would be some kind of requirements and knew that not only is Nexus preparing you for the NCD, but also this value-based world that we live in where everybody's expected to track data and outcomes. That's what Nexus does. And so if you think about how the NCD fits into our platform, it was really made for this in the sense that tracking data, tracking compliance, tracking symptoms is what we do. And we already have data on almost 160,000 patients now. And so we've got lots of experience in doing this. We've got devices connected. So all the ventilators on the market except for one are connected. And that's not because we don't want to connect with them. It's because so far they haven't been willing to connect with us. But any other device that you use, it makes it super simple when you're using Nexus. And so that means all the data is coming into one place. You've got reports. You've got the ability to track and document compliance. And we even can do it for you. And so if you're thinking about kind of Nexus, there's two options. One is we license it to you. You use our tool to track your patients. But in this case, because compliance is going to be difficult and tricky and a whole new process, and you're probably going to need new staff to do it, it may make a lot of sense to outsource. And so outsourcing our Vent 360 services, our Respiratory services is another option to really just kind of flip a switch and be ready to go for the NCD. But we check all the boxes right now with Nexus, and we're continuing to review this NCD and make sure if there's anything that needs to be tweaked in any of our programs, that's being tweaked as we speak. But we have reports around the NCD. We'll have RAD and BiPAP reports, or RAD and ventilator reports, as well as we'll have all those symptoms documented. So when you go in to see a physician and they're doing that 6-month follow-up to confirm compliance, and if the patient has continued need, they'll have a report that's literally an NCD ready report that says they check all these boxes already. Here's the compliance, here's the data. The doc can just simply look at it and know that they checked all the boxes. Same thing during the 7 to 12 months. And then ongoing, every month after that you need to track compliance, you'll have that information in Nexus. And again, we can also do it for you if you're not willing or ready or set up to do that yourself.